The teaching of skills within this video in no way implies that the viewer will be able to perform the skills. The skills viewed may only be performed when authorized by a certifying or licensing agency. Any devices used in this video are for demonstration purposes only. Other brands may be used as per local preference.
This video will demonstrate how to insert the King supraglottic airway. This is used when ventilation is required and bag mask device is difficult or endotracheal intubation has failed, as allowed by local protocol. The tip of the King airway is inserted into the esophagus, followed by inflation of the proximal and distal balloons. This occludes the esophagus and upper airway, allowing the patient to be ventilated through the side port of the King airway. The first step is to accumulate all equipment and properly position the patient. With the patient receiving ventilation with a bag mask device, the providers have gathered and set up all necessary equipment, including the King airway, syringe, suction, and appropriate monitoring. The King airway is inflated to assure the balloons are working appropriately. Fully deflate prior to using. Then, apply water-soluble lubricant to the distal tip. Making sure the patient is appropriately positioned, it is now time to insert the King airway. Positioning may be assisted with a shoulder roll. After opening the mouth, the King airway is inserted blindly into the oropharynx of the patient, starting at a 45 to 90 degree angle and rotated when it is finally seated into the esophagus. The tongue may need to be held down so as not to be pushed back while inserting the airway, thus preventing appropriate seal. This can be done with your finger or the use of an oropharyngeal airway. The balloon is then inflated to appropriately allow for ventilation. The airway is finally secured and attached to a ventilation bag.